All right, welcome. Hi, everyone. I'm excited to welcome you to our event, What Matters in Pregnancy, the Evidence in You. This event is co-hosted by Oula, the Maternal Fetal Medicine Associates, and the Motherhood Center. This event was really inspired to support you. As a mother and obstetrician gynecologist, I know all too well the emotions that we feel throughout our pregnancy journey, postpartum, and even in parenting. And let me be real, these are a whole host of emotions from excitement and joy to overwhelm and stress and fear and uncertainty. Again, this event is designed to support you. We're hoping that we can provide some useful information to sort of put tools in your toolbox of resilience as you decide how you want your pregnancy journey to look and how you're going to center your own self and your values. So welcome. To start a little run of the day here on our agenda, we're going to start with introductions. We have an exciting panel of friends here to provide the information you're seeking. And the information will include sifting through do's and don'ts of pregnancy, planning to really decrease your mental load as you're going through your pregnancy journey, as well as centering yourself and honoring yourself and your preferences. Just to reiterate, there is a live Q&A at the end of the session with all of our panelists, so please drop in those questions in the chat along the way. All right, let's get started. Our panel is a panel of 4 today, 3+1 actually. So I am Ila Dayananda. I am an obstetrician gynecologist and the medical director at Oula. Today, I'll be acting as your moderator.
Good evening, everybody. My name is Dr. Jennifer Lam-Rachlin. I'm an OBGYN maternal fetal medicine specialist at Maternal Fetal Medicine Associates, and I'm very happy to be part of this wonderful panel of people to talk to you today.
Hi, everybody. My name is Katie Sigler. I'm a certified nurse midwife, and I'm a midwife at Oula.
Hi, everybody. Thanks for joining. My name is Paige Bellenbaum. I am a licensed social worker. I'm also the founding director and chief external relations officer at the Motherhood Center, and also survivor of postpartum depression and anxiety.
Thank you, everyone. All right, we're going to take a minute to go through a little information about all the organizations that are hosting today. So to start off, Oula. Let me tell you a little bit about Oula. Oula is a modern maternity center. I want you to remember that we are here to set a new standard in care, and it's about time that someone set a new standard in pregnancy care. What I love about Oula is truly based on a collaborative care model. A collaborative care model to us on the clinical side is a tight collaboration between our midwives, who are truly the experts in physiologic birth, and our obstetrician gynecologists, who are there to support our midwives and to provide supplemental care. But for me personally, what I love about the model the most that's built at Oula is that the birthing person's at the center. The birthing person and their support people are in the center of our model. And then we have this cushion of high expert evidence-based care through our midwives and our obstetrician gynecologists that surround and support the birthing person. But it goes one step further. There's another layer of cushion and support. And this layer of cushion and support is care across the entire spectrum. And by that, I mean our excellent doulas and lactation consultants and pelvic floor therapists, et cetera, whatever the birthing person needs to really make this full spectrum care for themselves. Another exciting piece about Oula that really resonates is the use of technology. There is an incredible patient portal. And when we think of a patient portal, I often think that's a place I go to check my labs, or I might get some results posted there. This is far beyond that. This is a portal that really allows for ongoing coaching throughout the pregnancy journey, ongoing messaging, and two-way information flow throughout your pregnancy journey. There's also the ability to have your visits in person or virtual. The patient portal is just an amazing space where there's space for shared decision-making. The patient is centered, as I mentioned before, and really is involved in the care and the decisions that they're making throughout their entire pregnancy journey. And probably some of the best news about this entire model and what we're building and have built is that it is available to as many people as possible. We will be in network with all major insurance companies as well as Medicaid. So just sort of to wrap up, Oula was really created to listen to patients, to center patients. So often we hear that people going through their pregnancy journey don't feel heard and they don't feel a part of the process. And Oula is here to change that, frankly. We're going to lead, and we are leading with evidence-based care and we really trust our patients to know their bodies the best. I'm going to move on to a little introduction about MFMA, please.
Maternal Fetal Medicine Associates, we are one of the leading private practice that incorporates both generalists and maternal fetal medicine specialists like myself. We have 4 main sites with our main hub up in the Upper East Side, where we provide primarily high-risk obstetric care with some uncomplicated pregnancy and obstetric care. We do also offer well woman visits and gynecological care outside of pregnancy. One unique part of MFMA is that we also have 2 sites that provide ultrasound, prenatal ultrasounds and prenatal diagnosis, and also consultations for patients with high-risk pregnancies at our Carnegie Imaging for Women sites. We have one in Midtown and one in Upper East Side. Additionally, what's kind of unique to our practice is that we have in-house genetic counseling. So for patients that are either high risk for genetic conditions or found to be high risk based off of ultrasound or screening, we are able to provide them with genetic counseling on the same day, and procedure and testing is needed. And then another unique aspect of our office is that we provide pre and postnatal nutrition services for our patients and also for outside referrals. Specifically from a pregnancy standpoint, most of our referrals to our nutritionists will be when the patients get diagnosed with gestational diabetes.
And again, I'm here representing the Motherhood Center. I first just want to say shout out to all the expecting mommies in Brooklyn, joining you from Brooklyn too, as I know many of us are, and we all experienced the snow earlier today. So a little bit about the Motherhood Center. So we are a one-of-a-kind support and clinical treatment facility that provides support to new and expecting mothers that are experiencing what we call perinatal mood and anxiety disorders. I know this is a very long, fancy term. The acronym is PMADs, and it's actually what most people know of as postpartum depression. And so at the Motherhood Center, we specialize in treating PMADs, postpartum depression, and a number of other diagnoses that I'll get into a little bit later. But we do it through a whole host of different levels of care. First, we offer a multitude of support groups for new and expecting moms that really aim to meet moms where they are at and expecting women on their perinatal journey. So we have a PMAD support group, a pregnancy support group, we have a miscarriage and loss group, a group for women of color, and many others available for women who are looking for a sense of community, and finding that connection of being able to come together and talk about the challenging aspects of the transition to motherhood. We also offer individual therapy with specialized therapists who specialize in perinatal mental health, as well as reproductive psychiatrists who specialize in medication during pregnancy and the postpartum period while nursing. And then what we're really known for that just really doesn't exist anywhere else is our day program. And this is an intermediate level of care between inpatient and outpatient. So we exist to provide wraparound care to new and expecting moms that are having a very difficult time caring for themselves and or their baby. It's a robust program, and one of the greatest things about it is that it helps women feel much better, much faster.
Wonderful. Thank you all for that introduction and more information about your organizations. Very excited to hear more. We're going to go ahead and launch our program. We're going to start with Dr. Jennifer Lam-Rachlin. She's going to talk to us a little bit about sifting through the do's and don'ts of pregnancy.
Jen, you're muted.
Sorry about that. Thank you so much, Sheila. So to start off again, I'm a maternal fetal medicine specialist, which means that I did additional training outside of OBGYN to focus on kind of the nuances between maternal factors that influence the pregnancy, the fetus, and vice versa. one of my main roles in life is actually I'm a mother of 3. And what I felt in terms of my pregnancy, even though I'm a specialist in these high-risk pregnancies, what I think is inevitable for patients that when they're pregnant is to really kind of shelter themselves out from the noise and myths of pregnancy. And I'm not immune to that even when I was pregnant myself. And pregnancy in general, I would say, is a very stressful time period for everybody. When I was pregnant with my first pregnancy, I was going through my fellowship training. So definitely much more stressful. And then to find, all this, noise about what you can do, what you can't do during pregnancy, you always have this mommy's guilt, which starts off probably before conception and definitely amps up at the moment of your urine pregnancy test being positive. So what we're trying to do today is really try to shelter out some of the noise, go through some of the myths of pregnancy, and then focus on what really is the most important topics and what are the don'ts in pregnancy, which would be surprising to a lot of people, which is actually very few things are don'ts and a lot more do's, and to make it as stress-free as possible. So some of the myths that we came up with that we hear a lot of when our patients come into our practice, myth number 1, if we have sex, I can hurt the baby. Myth number 2, I should stop running or exercising because it would shake up the baby. Myth number 3, I wasn't able to take my prenatal vitamins. This means that I've done irreparable damage to my baby and my baby will have birth defects. Myth number 4 is generally a very common one. I was drunk or I drank before I was pregnant, and I definitely for sure have impacted my baby's development and created fetal alcohol syndrome. Another common myth, I woke up and found myself on my back. Does this mean that I damaged the baby? And the last myth, I heard I should not take any vaccines while I'm pregnant, including the flu vaccine. So these are all common myths, which means that they're not necessarily true. So let's go to the next slide and I'll go through kind of a few topics of what actually does matter. So as I said before, there's a lot more do's than don'ts in pregnancy. So hopefully this will help alleviate some of the guilt that you have coming into the pregnancy. I separated out some kind of main topics. So things to pay attention to and avoid during pregnancy. Number 1 thing would be Listeria, which is a bacteria that's commonly found on food and the instruments that are used to prepare the foods. Common theme that comes up during pregnancy would be, you have to avoid cold cuts and soft cheeses. And this is where the Listeria comes in. Can be harmful to the pregnancy in the sense that it has been associated with miscarriages and stillbirth and preterm delivery, so obviously it's not something that you want to get during pregnancy, but in reality, it is actually extraordinarily rare. Even if you expose yourself to potential at-risk foods, the likelihood that you actually get Listeria during pregnancy will be very, very, very low. So what are some of the common foods that potentially might be a Listeria risk? What's unique is we always kind of have cold cuts as one of the top categories. That's based off of a study back in the 90s. But more recently, the most recent Listeria outbreaks have not been in cold cuts. It's been in prepackaged hummus, prepackaged cantaloupes, frozen vegetables. So why is that the case? So what generally happens with Listeria is that even if it's on the food but you heat up that food, the Listeria source dies off. So you ingest it, you're not going to get Listeria. What happens is Listeria kind of lingers on the machinery that pre-cuts, pre-packages food. And if there's something that's pre-cut, pre-packaged, and generally not heated up, those are all potential Listeria sources. Now, what I usually tell my patients is that means that you can almost never eat anything out, right? But if it comes down to eating something because you're hungry or you missed a meal and you're on the run versus I'm not going to eat anything because there might be potential sites of Listeria, go ahead and eat it. You're going to be fine. You're not going to damage the pregnancy. But it's kind of being very mindful of any recalls in the news. Make sure most of the food that you consume is heated up. Even if it's cold cuts, you could heat that up into a sandwich melt. You're going to be totally fine. Pasteurizations will also kill off the Listeria. So pasteurized dairy will be safe and fine. In terms of symptoms to watch out for, if you do know that you expose yourself to a potential Listeria recall and you're having symptoms that's consistent with Listeria, which generally is high fevers, gastrointestinal discomfort, very rarely some neurological changes, obviously let your obstetrician know. But again, as a FYI, it is extraordinarily rare. It's not something to be concerned about, even if you potentially had a at-risk exposure. The second topic on things to avoid are probably very obvious, would be to avoid toxic habits. So alcohol drinking, smoking, and drug use. I think smoking and drug use are very self-explanatory in terms of why you avoid them during pregnancy. Alcohol does come up as a very common question, like, what is a safe amount? Are you sure I can't have that one glass of wine? I had a terrible day, right? I would say that prior to 2 to 3 years ago, we used to tell patients, go ahead, you had a bad day, have a half a glass of wine, especially when you're in your third trimester, you're uncomfortable, you can't sleep, you're stressed. Go ahead, that's safe. That tune has changed just because everybody processes alcohol, metabolize them at a very different rate. And there's no good test to say, okay, you know, you're going to metabolize it faster so you can tolerate a glass of alcohol versus someone else who's going to metabolize it slower so you can only have half a glass. So as a blanket statement between the pediatric and the obstetric governing bodies, they have suggested avoiding all alcohol, and there's no, quote, safe amount during the pregnancy. So I cannot safely tell patients to have a half a glass of wine. If you do expose yourself to that one-time alcohol, it's probably not going to cause any damage. The main concern with alcohol would be for fetal alcohol syndrome, which generally is associated with longer and more chronic exposure to higher doses of alcohol. And what also commonly comes up is most people may not be planning a pregnancy, so they may have had some, you know, days of drinking prior to their positive pregnancy test, and they get concerned about, you know, those days, whether it was binging or whether it's just 1 or 2 glasses of wine. For the most part, that's not going to be a concern during the pregnancy, as long as it does not continue during the pregnancy. So kind of big sigh of relief and move on. The third topic, broad topic, is toxoplasmosis, which again is another parasite. It's a condition that, if you get during pregnancy, can cause birth defects for the baby. So that's why we do try to avoid that. Exposure to toxoplasmosis tends to be in raw meat. It gets deposited into the muscle of the animal that is ingested, but again, gets killed off by cooking. So as long as something is thoroughly cooked, you should not be at risk for getting toxoplasmosis during the pregnancy. Cats come up as a very common question, and I think many people have heard of, don't change the litter for your cats, or you might have to send your cat away to some other family during the pregnancy. But for the most part, domesticated cats are not at risk for toxoplasmosis. You're mostly concerned with feral or stray cats because you don't control what they eat. So what happens is these stray cats can eat and expose meat that have toxoplasmosis, and then it comes out through their fecal matter. And so when you change their litter, then you're exposing yourself if you don't wash your hands. So you want to maintain good hand hygiene, but in general, domesticated cat is not really at risk for toxoplasmosis. Another big topic is mercury exposure. Again, a common theme that patients have heard is, oh, you should avoid fish altogether during pregnancy, right? Because you want to avoid mercury. But that's not true, in the sense that fishes have very good sources of omega-3 and could provide good nutrients and proteins during the pregnancy. So, and for the most part, most standard fish in the standard American diet are very low in mercury. So I generally tell patients the high mercury fishes are your big fish, right? Your big fish in the ocean can get exposed to mercury. And the list that I have here are the fishes that you try to avoid. And for the most part, I would say they're not quite standard in American diet. So king mackerel, shark, swordfish, marlin, and tilefish. Tuna, I purposely left off this list. Although there are tunas that are high in mercury. The ahi tuna and the big eye tuna are the two tunas that are much higher in mercury, so you want to try to avoid those. But there are also tunas that are much lower in mercury. So, you know, most common question comes up would be like tuna fish in a can. I had a tuna salad. Did I just, you know, give myself too much mercury and give the baby too much mercury? Like tuna has actually a very low level of mercury. You could safely consume 1 or 2 servings in a week and be totally fine in terms of being within the safe mercury level for pregnancy. Albacore tuna tends to have a little bit more, but not that much more. So again, one serving every 1 to 2 weeks for albacore tuna is perfectly safe and fine. And then the last topic I put here to pay attention to would be vaccines. So not all vaccines are bad. For the most part, most vaccines are fine. What you want to try to avoid are these vaccines that are live vaccines. So there's certain vaccines that are given where they give you a little bit of the live virus to generate an immune response. In those cases, obviously, that's not something that you want because these viral infections can cross the placenta and can cause birth issues. So you don't want to have any live vaccines during pregnancy. But for the most part, most other vaccines are actually not live vaccines. With particular in the season that we are in right now, the flu vaccine is not a live vaccine. It's actually very much recommended during pregnancy. Then I try to compile common things that are really not so important in terms of avoiding during pregnancy, but you may have heard of it as big issues, right? So one would be caffeine. Again, I was pregnant with my first pregnancy in fellowship. If you told me I couldn't have my cup of coffee every day, I would probably not last through my pregnancy. So kind of looking at the studies, you know, with very rare exceptions, 1 to 2 cups per day of some caffeine is fine, whether it's coffee or soda or tea. The kind of the evidence or the studies looking at caffeine intake and pregnancy really becomes a concern when you're talking about excessive caffeine use. So over like 10 cups of caffeine a day, which I think for the most part, most people don't drink. Even in those cases, it's very loose in terms of the association and maybe associated with like higher incidence of ADHD in those excessive amounts. So for the most part, 1 to 2 cups per day of some caffeine, totally fine and safe, and go ahead and have it. I already spoke about for the flu vaccine, it's not a live vaccine with the exception of the nasal. So with the injection, that's a dead vaccine. Fine and safe to take during pregnancy, actually very highly recommend during pregnancy because flu, when you get the flu in pregnancy, it can be a lot more severe, a lot more deadly than if you were not pregnant. So this is kind of our only way of primary prevention with the exception of, you know, hand hygiene and the usual precautions that we're taking. Common questions that come up is exercise. You know, does this mean I have to be bedbound? You know, I shouldn't, jump around too much. I'm going to have a miscarriage. Those are very common things that people ask me about. Again, in general, most exercises are totally fine. What I tell patients is the obvious ones that you want to avoid is anything that can cause direct abdominal trauma, which, you know, I can't think of a clear example, but like, you know, boxing, wrestling, football, those are probably exercises that you want to avoid, but for the most part, all the others are fine. What happens in pregnancy is your heart rate is generally a little bit higher than prior to pregnancy. So it's almost like your body's doing a light cardio on a 24-hour basis throughout the pregnancy. So what you might notice is that your endurance and your tolerance is a little bit less. Don't try to push yourself to pre-pregnancy abilities. Just kind of listen to your body. See what your body can tolerate. Stay very well hydrated before, during, and after your exercise. And I don't usually give patients, a cutoff of, oh, how high can your heart rate be? I think that's very hard to monitor for. I usually tell patients, if you're able to at least carry on a conversation, you're probably doing fine. If you are gasping for air and you can't even complete a sentence, you're probably working out too hard. So that's the easy parameters to look for. Fish consumption, we already talked about. In general, again, most fish is fine. Salmon is fantastic during pregnancy, great protein, great omega-3. Sushi comes up as a very common question because it's not cooked, right? So you run the risk of having any foodborne illnesses from sushi. But in general, actually, in reputable sushi restaurants, depending on where they source them, it's very rare to get any food poisoning related to sushi. So all the concerns that we talked about in terms of toxo and listeria, that's really not an issue with sushi. And I actually I don't restrict my patients from it. So I usually say if it's a place that you've gone to before and you've never gotten sick, it's probably safe to do and consume. Probably not the time to try out a new place. Another common misconception is that I can't have sex during pregnancy or else I'm going to injure the baby. Again, there's generally no limits. Sex, orgasm, all that is fine during the pregnancy. There are some rare exceptions during pregnancy that your provider will probably tell you to hold off on sex during that time period. But again, they will let you know. It's not the general population, and it's a very small percentage of patients that will tell you to hold off on sex for a short period in the pregnancy. Ultrasound safety, I could talk a lot about it, but in general, I say, trust your providers when they send you for an ultrasound. Routine ultrasounds for pregnancies are safe. We're not going to do anything that's damaging to your baby. It will obviously be very important in terms of diagnosis in all trimesters of pregnancy. What we kind of discourage as a practice would be for any of the, fun and recreational ultrasounds where you go to these ultrasound units that all they do is just 3D and 4D ultrasounds to give you a memento. They're not as regulated as a licensed medical ultrasound unit. So that is generally discouraged. Sleep position also comes up. Do I need to start sleeping on my left side from the beginning of the pregnancy? I would say in general, it does get harder to sleep on your back if you are a back sleeper. You have a growing mass basically in your belly and it's pushing on the blood return to the heart. And at some point it just kind of gets uncomfortable. You get short of breath if you're on your back. But it's also, you get more and more uncomfortable in general during the pregnancy. So your sleep quality and sleep duration decreases with time. And sleep is so important to have leading up into labor and leading to kind of postpartum recovery and taking care of your baby. So most important to me would be whatever position it is that allows you to get good sleep is probably a good position. You're not damaging the baby in any ways. If you're, if the pregnancy is pushing against your blood vessels and there's low blood return, you're going to wake up from that. You're going to wake up and move yourself into a position. Sometimes I tell patients that, who really like to back sleep but just aren't able to tolerate it, you can mostly sleep on your back, but maybe put a pillow under one of your hips and tilt your pelvis just so that relieves some of that pressure. And then the last item, travel and planes, which is all kind of relative right now with COVID, but in general, let's say you were allowed to freely travel. Again, there's really no restrictions in terms of plane travel. It is safe. Just stay well hydrated. And if you know it's going to be a longer trip, I usually tell patients you want to try to move around a little bit, because the main risk of travel would be just the retention of blood in your legs and potentially increasing the risk of clotting in the legs. So every like 2 hours or so, try to get up, walk up and down the aisles, which your bladder will predict what you do anyway. You're going to go to the bathroom every 2 hours anyway. So if you just take that time period to kind of walk up and down the aisles. But otherwise, again, with very few rare exceptions, we generally don't restrict any plane travel. So those are kind of the topics that I thought of in terms of, you know, what is important, what isn't important. And the general kind of overview is, you know, there's much more things that you can do, much less things you can't do. And, you know, your baby is very resilient. So you don't worry about too much of what you've done, what you haven't done. Just try to enjoy the pregnancy as much as possible. And then I'm going to hand this off to Paige, and she'll talk about planning for your mental health.
Thank you, Dr. Lam. So I'm going to speak to you a little bit about emotional wellness and mental health in the perinatal period, especially during pregnancy. And it's something that we don't talk enough about, and it's so important. And I'm going to let you know a little bit later on why, but why paying attention to our own mental health and wellness is something that is very, very important as we are beginning on and continuing our journey in the transition to motherhood. So as I mentioned in the beginning, what we do at the Motherhood Center is we treat PMADs. And so just a little bit about what PMADs are. Perinatal mood and anxiety disorders include, both during pregnancy and up to 1 year postpartum, the following diagnoses: depression, anxiety, OCD, postpartum stress disorder, bipolar disorder, and in rare but very serious instances, psychosis. And what a lot of people don't know, because we always hear the term postpartum depression, we think that it typically, if not always, originates in the postpartum period, but actually 50% of all perinatal mood and anxiety disorders originate during pregnancy. And I want to talk for just a quick second about prevalence. And I want to say that on the health side of the spectrum, everybody is tested for gestational diabetes, and preeclampsia and other conditions are something that we keep a very close eye on for good reason. Yet 1 in 5 new and expecting mothers experience a PMAD. And in times like a pandemic, what we're seeing as mental health clinicians is more like 1 in 3 women, right? So we're screening for these other things in the physical health realm, but we're not screening for the #1 complication associated with childbirth. And it's why this conversation around emotional wellness and mental health is so important for new and expecting moms. So many of you, if not all of you, have heard of the term baby blues. 80% of all new mothers experience what we call the baby blues. But like I said before, 20%, and if you look at current research that's recently been released during the pandemic, upwards of 50 to 70% of women are actually experiencing mild, moderate, or severe depression and anxiety during pregnancy and in the postpartum period. So how do we know if it's the baby blues versus having actually a PMAD? So most women experience the baby blues, and it can last anywhere from 1 day postpartum to up to 2 weeks after the baby comes. It can include feeling irritable, feeling overwhelmed, feeling anxious, feeling weepy, crying at the drop of a pin at things that might have made us laugh before. Our hormones are so doing a dance and tidal wave within us that our emotions and our feelings are running rampant. Usually right around the 2 week mark, things start to stabilize a bit more. New moms start to feel a little bit more of a groove. They start to kind of get their bearings a bit. But in a lot of instances, these symptoms and feelings can go beyond the 2 week mark, and they can also become more extreme and become exacerbated. And so that's really something that we as clinicians who treat mental health in the perinatal period look for is, are these symptoms getting worse, getting bigger? And are they continuing on into 3 weeks, 1 month, 3 months? So I would just wanted to spend a quick sec talking about some of the different symptoms and feelings that are associated with having a PMAD. And I separate these into mood, because we've got mood disorders, and anxiety disorders. I don't even like to use the word disorder because it sounds so super clinical. So mood and anxiety. So when our mood is being impacted during pregnancy and postpartum, we could be feeling helpless, hopeless, having a really, really difficult time making a decision, even if we're the most decisive people ever. And in our former iteration of self, we were like, I like that, I don't like that, we're doing it this way. A PMAD can take all of that certainty away from us. We're not able to find joy in the things that used to bring us joy, whether it was our favorite Netflix episode or series, whether it was going for a walk in the park, all of these things that used to make us feel excited or forward thinking, we're just not feeling that way when we think about them or do them. Unable to bond or connect with our baby. This is so common. And I put it into the myths of motherhood category that Dr. Lam did such a great job spelling out. There's this preconceived notion that the minute that the baby comes, we're gonna feel this amazing, blissful, unconditional love and connection with the baby. And that is not always the case, especially after a long labor. I like to say to new moms, well, did you feel unconditional love to your husband the minute you met him? No. How about your best friend? No. Well, then why would you feel that way about something that has been in your body and taken over your entire midsection for almost 10 months, that you just went through this birthing process? I mean, like, it's going to take a minute. So not feeling connected right away is totally normal. If we see it go on further than a month or so, then we start to wonder, is there something here that we can assist in between mom and baby connection? Anxiety, feeling overwhelmed all over most of the time, feeling super anxious, having panic attacks, heart palpitations, shortness of breath, feeling as though our mind is a hamster wheel and it just keeps going and going and going and we can't turn it off. Catastrophizing, going to the worst possible case scenario in most situations pertaining to the baby, jumping to conclusions, or feeling this ongoing sense of impending doom, something bad is going to happen. And then lastly, a symptom that we overlook frequently, and again, 80% of all new mothers experience this, scary intrusive thoughts, having these fears that pop into our head, sometimes very graphic, of fear or harm coming to the baby, and feeling absolutely repulsed by the fact that our mind could come up with that thought. 80% of all new moms has scary intrusive thoughts, and it doesn't necessarily mean that you have a PMAD, but they're that common and frequent. Next slide. So what's important to know is that everyday stressors can really have an impact on our mental health, especially right now. What I say to so many women is some of the primary characteristics of what contributes to developing a PMAD are now the new normal. Isolation, lack of social support, managing high levels of stress and anxiety. This is what it is to be a person in a pandemic, let alone a new or expecting mom. So it makes sense that we're seeing these significant increases in anxiety and depression in the perinatal period. What we see so often can contribute to a PMAD. Previous trauma, right? Even if we've done a lot of work therapeutically or clinically on our previous traumatic experiences, pregnancy, birth, and postpartum can be very triggering in experiences and really bring back a lot and resurrect those traumatic experiences that we had before. Juggling childcare and work, I can't tell you how many women return to work and then experience a PMAD because it's so overwhelming to try to keep all these balls in the air. Marital stressors. Having a baby can be one of the most challenging times for a couple. It is a total life transition for both of you. And it can have an impact on our emotional wellness and mental health. Fertility struggles. You know, women think after they've been on a short, mid, or long-term journey to get pregnant, that once it finally happens and they experience pregnancy and they give birth to the baby, they're going to be so overjoyed because they've worked so hard to get to that place. Nobody says that fertility struggles can be one of the #1 contributing factors to developing a PMAD. You've gone through all of these chapters in your fertility journey, loss, grief, trying again, that all has a residual impact on our emotional wellness, and it needs to go somewhere. So it can absolutely be an open invitation to a PMAD. Miscarriage as well, and just simply looking at everything that's going on in the world today, these are all examples of stressors that can impact our mental health. And so most importantly, please don't forget that you matter. There's a saying we have at the Motherhood Center. It's the pregnant princess and the postpartum pauper. For those of you who are pregnant, and I know it's a little bit different now because, you know, I led a group today in the day program, and all we talked about was grieving the loss of what we thought was going to be in our pregnancy and postpartum period. When we're pregnant and not in a pandemic, we have everyone around us that can see us being pregnant, right? We go to work and our coworkers say, oh my gosh, you totally popped, or you're showing. How far along are you? Everyone's looking at us, they can see us. We're being celebrated. People are asking us questions. How are we feeling? There's this whole community around us that is paying attention. Less so in a pandemic because all we see is shoulders up. And so we had a coworker at the Motherhood Center who was pregnant throughout this entire pandemic. We never got to see her belly. We knew she was pregnant, but we didn't get to share that with her. And so then once the baby comes, and then I'll get to the next slide, all eyes are on the baby. Nobody's really paying attention to mom anymore, right? So focusing on you as much as you can, prioritizing your own needs, asking for help is critical as you continue that transition to motherhood. And just a couple of things that you can do while you're pregnant. First of all, I want to use breastfeeding as an example. I'm sure many of you have heard that being a mother to an infant is a full-time job. I would say it's 2. Breastfeeding on its own, for those of you who decide to breastfeed, and we definitely have a feeding is best policy at the Motherhood Center, whatever you decide to do, if you do decide to breastfeed 10 to 12 times a day, 15 to 60 minutes a session, that's 12 to 15 hours a day that you cannot get up. You can't use your hands other than what's right in your immediate vicinity. That is a full-time job that eliminates your ability to go do the laundry, clean the dishes, this, that, and the other thing. So when we think about how much time that's going to take up and how our responsibilities are going to shift, this is a time in your pregnancy to have this conversation with your partner. What's the division of labor look like currently? And when we take into consideration that 12 to 15 hours of my life are going to be spent sitting somewhere breastfeeding our child, that means I can't do these other things that by design I have been doing. So we need to talk about reshuffling those responsibilities. And until we decide otherwise, I'm going to need you to take out the dark garbage, do the dishes, cook or order the majority of our meals because I'm going to have my hands full. And then plan for additional responsibilities. And then also asking for help ahead of time, knowing that all of these things are coming down the pike. Practice asking for help now, especially if you're somebody who has a hard time asking for help, because you're going to need it. We all do. Even those moms who appear to be killing it and doing it right, they need help too. And so practice getting outside of your comfort zone now, asking for things that you might not necessarily ask for because you're going to need help and you're going to need support from your partner. And just one thing that I want to alert everyone to, especially all my Brooklyn mamas to be, there's a favorite book I have called How Not to Hate Your Husband After Kids, written by our local author here in Brooklyn by Jancy Dunn. It's such a beautiful depiction of like bringing comedy to what happens after we have a baby, but also providing very concrete techniques and skills on how we can get our partner more involved. And then just last in the area of concepts, there's a term we use all the time at the Motherhood Center, and it's good enough, being a good enough mother. So many of us strive for perfection. It's everything that we see on TV shows, on commercials, on the box of Pampers diapers, on social media, is this like glamorization of motherhood and how it looks super perfect and everyone, you know, looks great. And I'm sorry to break this news to you, but those are depictions of things that aren't necessarily true, right? the transition to motherhood is challenging and it's amazing and beautiful. It's both. It's another concept we use a lot at the Motherhood Center. It's both and. You can love it and you can hate it at the same time. That's what it is to be a human. But being a good enough mother, and we have research to suggest as much, and we have this amazing paper that was written back in 1953 and holds true today, is that babies actually benefit when their mothers fail them in manageable ways. So they learn how to experience setbacks, failures, their mother not doing things perfectly, which ends up better positioning them for what life is like outside, because life is filled with disappointments. It's filled with failures. And the more that our toddlers and children can experience this, the better equipped they are to be a high functioning human, because that's what life looks like. And children need to learn that the world doesn't revolve around them. And even if things are hard and it doesn't go their way, they're still going to be okay. And so just last fact, building our children's resilience is the gift of a good enough mother. So as you're pregnant and you're thinking about how you're going to buy all organic vegetables and puree them or grow them in your backyard, and you're going to buy organic diapers and you're going to do all of this stuff, and you have all these ideas, I want to give you permission right now that if your baby hates the organic pureed vegetables like both my children did, and you feed them food out of a bottle, that's okay. That's good enough. You're doing a great job. And now I'm going to pass it over to Katie Sigler.
Thank you so much, Paige. I'm so excited to be listening to this and to really sort of be here on this panel, because I think it really gets at what I, as a midwife, really want for birthing families. We're trying to find an intersection between the evidence that helps to guide our, us as clinicians, and really what you need. So at Oula, we're really working to be the guide through that intersection. And it's my job as a midwife to help you understand the evidence and to really think about your own values and motivation, and to give you the space to recognize your own values. So, I think what's exciting and also really hard about planning a pregnancy is to recognize how much thinking there is to do about what you want and what you need out of the experience. So, some of the things that you want to think about are very pragmatic, and some of them are really quite philosophical. And I always like to frame this idea by talking about autonomy. Autonomy is the idea that you are the keeper of your body, and you are the decision maker for what happens to you and your family. And sometimes that can be, a challenging position. So my job as your healthcare provider, as your midwife, is to help you understand the risks and the benefits. And your job as the birthing person or as a birthing family is to really think about what your preferences are, and think about what is important for you so that you can make the best decisions for your family. I think about this in terms of consent. Consent is an idea that's important to think about, like in real time. You should expect that when I enter the room, I'm going to say, is it okay if I touch you? But you also need to think about consent in the bigger, more sort of global idea, like, do I give permission to this team to take care of me? Is this the team that I want to be thinking about my birth with me? And thinking that through and making those decisions is really a big responsibility. It's important for your own preferences to really be at the center of your pregnancy planning. Again, some of these preferences might be really practical. What's your insurance going to cover? What's something that you can afford? And like I said, some of them are much more philosophical. Is this some place that you feel safe? How does your partner feel? Are you and your partner in agreement about what the best birthing environment is going to be? Because that's an important, that's a really important conversation to have. It's, I always feel like the decision-making that will drive your partnership as parents really starts in the pregnancy space. You need to work together to make decisions about what is appropriate for your birth and for that collaboration and compromise. So I always like to say that choosing the type of space where you birth is really a fundamental decision, and it's one that really has to happen kind of early in the process, because the type of provider that you choose is really going to be the gatekeeper for your birth environment. So, you know, you will want to recognize that there are only so many home birth midwives in New York City. And so if you decide that you want to have a home birth, you know, it's important that you start meeting with them early in the process so that you can make sure that you have the team put together that you want. You know, fundamentally, there are 3 primary spaces where you can give birth here in the New York area. One is a home birth. Another is an out-of-hospital birth center, and then the third is a hospital. You know, when I initially started imagining this presentation, I started making pro and con lists for these various sites. And then I realized that it's really impossible for anyone to impose their pro and con list upon anybody else, because one person's pro might be another person's con. And so this is something that's really a very individual decision, and something that you really have to think through on your own. So it really depends upon your lens, and really depends upon what is most important to you. You know, for example, like a home birth or a birthing center might feel a little bit less medicalized, but there might be somebody who thinks that, you know, an epidural anesthesia or some of the trappings of the hospital environment are really important to them. And that's a situation that makes them feel safe. I always like to use the example of my own child's birth. I had a very low risk pregnancy, and I planned a hospital birth with a midwife. I did consider a home birth because it really aligned with my goals for having no interventions in birth. But having worked as a labor and delivery nurse during my pregnancy, I knew that I was worried that I might not be able to turn off that little voice in the back of my brain, that I might need the hospital after all. So in the end, I made virtually no use of the medical establishment. I might as well have had a home birth, but being at the hospital made me feel safe. So that was the right decision for me. That was the right space for me, because it helped me to feel safe. And that's the kind of decision-making process that you need to think through. The midwifery model really tells me that laboring people do well, and labor works best when the patient feels like they're in a safe environment, and they're being heard, and they're being comforted in a way that's important to them. You know, it's important to recognize that safe feeling can really contribute to a successful labor. And so you want to make sure that you have that safe environment chosen for yourself. So I love this representation of the Oula model that Oula put together. The most important person to notice, of course, is that the birthing person and their support people are at the center, with their midwife and the OBGYN in that first concentric circle, and then the broader support network really surrounding the patient. And I think this event today is really a representation of that broad circle. We're here, you know, from the Motherhood Center, from Oula, from MFMA, really working together to think about how we can collaborate to make sure that our patients feel safe and feel like their care is really well coordinated for them. You know, I always like to think that as the collaborative relationships that I have with physicians like Dr. Lam-Rachlin, Dr. Dayananda, those are the collaborations that help me to be reassured that my patients are low risk. So when I call a patient low risk, it's because I've worked with maternal fetal medicine specialists to ensure that my patients and their babies meet that criteria. So, you know, this broad network of people that we can draw upon to care for our patients is really a crucial one, and really centers our care at Oula. So obviously I could really philosophize about the birth experience all day, but I want to make sure that we save some time for questions. And I know we're getting a little bit close on time, so I'm going to turn it back over to Oula to moderate our Q&A.
Thank you, Katie. And a big thank you to Jennifer and Paige and Katie for the wealth of information they've shared here. I will note we just have a couple minutes left till the 5 o'clock hour. And again, I think it was really important to hear all of those presentations, but I do apologize that the Q&A is starting off a little late. We are going to go ahead and continue on the Zoom. So please feel free to stay. Please feel free to continue to put questions into the chat, and we'll kick it off here in just a second. For those of you that have to jump, I do want to just share with you that Oula is live, and we are offering virtual appointments already, preconception and early prenatal care appointments. So please check out the website, www.oulahealth.com, if you're interested in scheduling an appointment with one of our midwives. For those of you that can stay, I'm excited to go ahead and engage our panelists. So to start, I'm looking through the chat and the questions that are coming through. This is a question for Paige, please. A lot of folks, I think a lot of what you said resonated with many people on the event, including me. I love this idea of good enough mothering and parenting, and just really gave me the opportunity to sort of take a sigh and say, okay, I can do this. And I'm wondering, one of the questions that's coming through, are there any particular tools that you recommend as people are going through their pregnancy journey? How do they go about prioritizing their needs throughout the journey to really ease that mental load? And then sort of a part two, if you would, to that question is, as they're going through the pregnancy journey and they hit postpartum as well, how do they know if they're struggling with PMAD? What's a sort of a quick self-assessment they could do? And what should they do if they think they are struggling with PMAD?
So what you're already feeling and what you're probably going to continue to feel is that on the hierarchy of needs, as a new and expecting mom, we find ourselves below our pets in a lot of instances. And so what I want to impart in all of you that are joining us today is this concept of a happy, healthy mom equals a happy, healthy baby. And if you're taking care of yourself, both physically and emotionally, not only are you taking care of you, but you're taking care of your little one. And so I don't want to see it, I would encourage you not to look at it as an either or, but as a together. And so please keep that into consideration. And the other thing I just want to say, because I know that everyone had a lot thrown at them today about things that could potentially happen. As common as PMADs are, they are super, super treatable. It's what we do. We see women leave our care every day, multiple times a day, feeling like themselves again, feeling much, much better. So I just want you to know there's so much hope if you do find yourself struggling. And then the second part of that question, how do you know if it's a PMAD? We talked a little bit about the difference between baby blues and PMADs. Here's how I would describe it in kind of very simplistic terms. We all live at a baseline. It's where we hang out most of the time, where our mental health lies, where our emotional stability or wellness lies. If we are finding ourselves so far removed from our baseline, if our level of distress is something that's taking up a large portion, most of or all of the day, the anxiety, the feeling of hopelessness, helplessness, wanting to escape, if we're living there a lot and we're that far away from our baseline, then it's probably worth picking up the phone, calling the Motherhood Center. We can do a quick screen, speaking with your therapist if you're already in treatment, to just get an evaluation to find out for sure, right? That's the best thing to do. But if you're feeling so far removed from where you usually are, and those feelings are so distressing, then there's probably something beyond baby blues at play.
Thank you, Paige. I really wish I had a lot of this information throughout my pregnancy and postpartum. It really resonates. So thank you for sharing that more in depth.
Me too.
Yeah. A quick one for Katie and hot off the press. Folks want to know, where will Oula be delivering? At which hospital?
We are excited to announce that we are partnering with Mount Sinai West Hospital, formerly Roosevelt Hospital, which is in Hell's Kitchen, although it's not as hellish as it used to be, on 10th Avenue between 58th and 59th Street.
Fabulous. All right, so you heard it here first. Partnership with Mount Sinai West is in progress. Wonderful to hear that. I'm going to shift over to Jen. Okay, this is a very timely topic, of course, a big topic around COVID. So if you could briefly share a couple questions coming through. What do folks need to know about COVID during pregnancy? Are people who are pregnant at greater risk? And then, of course, the vaccine, that's all the rage now. And thank goodness that it is. But is the COVID vaccine something that a pregnant person can take safely?
Thank you, Oula. Definitely timely topic. It's a huge topic. I think it's spend more than an hour on it. I think the easiest way to kind of answer that question is obviously there's new data that's coming out every day. There's going to be data that's very confusing to interpret because they can contradict each other. But just specifically talking about COVID and pregnancy, generally we think of infections as during pregnancy. Is it something that will be more susceptible when you're pregnant versus non-pregnant? And the general consensus with COVID, and seems to be panning out with all the data that has evolved since the beginning, is that pregnant women are not more at risk of getting COVID than if you were not pregnant. So the general routine precautions that people are taking, which social distancing, mask, face mask wearing, and normal hand hygiene, all that are still something that a pregnant patient should do. But just being pregnant doesn't make you more at risk of getting it. It doesn't seem that pregnant patient is significantly at higher risk of severe disease. So the other question would be, okay, if we're not more at risk of getting it, but if I get it, doesn't mean that I'm going to be that much more sick. Is this a medical comorbidity? But it doesn't seem to pan out. There's going to be contradictory studies here and there, but overall, the overall kind of emphasis have been from most of the studies and most of the governing body has been that in general, a vast majority of pregnant women who get COVID actually don't get severely sick. And you're really looking at a very small percentage that get very sick, requiring hospitalization, and most patients will be an outpatient. And you're looking at, at least 90 to 95% of patients will be outpatient managed. And then in terms of treatment for COVID, again, generally don't withhold any treatment that we would normally give to someone who is not pregnant. So every treatment that is given to someone who's not pregnant is also available for pregnancy. The biggest topic right now is the vaccine, which it's a TBD to see what happens. But tomorrow the FDA is having a decision on regards to whether they're going to allow for emergency use authorization for the COVID vaccine in general for the general public. And part of that EUA will be to decide, will the FDA decide that it's safe for pregnancy and expand the usage for pregnant patients and then also children? For most of the big trials in both Europe and the US, they have purposely excluded pregnant and women and children just because they're a vulnerable population, which is the standard with a lot of new drug trials. But kind of in the new phase of enrollment, they are starting to enroll some pregnant women into it. And I believe that there's about 100 to 200 of pregnant women that have gotten the vaccine without any adverse outcome. The good thing with this vaccine is that it is not a live virus. The kind of unknown about the vaccine is it's a new type of vaccine. It's an mRNA vaccine that kind of stimulates your immune system to recognize the genetic information that COVID has. So it's similar to prior vaccines in the sense that they're not giving you the actual virus, but you're kind of stimulating your immune system to build up some immunity. As far as we know, it should be safe in pregnancy, but again, it would require a lot more data to kind of confirm that. What's kind of interesting is that there's, a few large governing bodies in the US for OBGYNs, and one of the big societies, Society of Maternal Fetal Medicine, which I'm part of, has come up with a statement that basically encouraged not only enrollment of pregnant women into trials, but consideration for pregnant women to obtain the vaccine if the FDA approves it for emergency use tomorrow, specifically for patients that are much higher risk. So patients that maybe have some medical comorbidities, or maybe they work in a high risk environment, such as like healthcare providers and stuff like that. But again, it's a very complex conversation and decision that would be made.
Yeah, so it sounds like the answer to that vaccine question is to stay tuned for now.
Yeah, exactly.
Yeah. Thank you so much. That was very helpful and informative. I'm going to shift gears a little bit. We just got a question about hypnobirthing. This one is for Katie. Do you have any experience with hypnobirthing practices? And just sort of would love to hear your thoughts about hypnobirthing.
Yeah, I have seen women and birthing people do amazing things with hypnobirthing. Again, I feel like it's such a personal decision. For those of you who aren't familiar with it, hypnobirthing is a strategy for coping with labor that involves some like audio tapes and meditative practices that are meant to sort of get the birthing person into a hypnotic state as a coping mechanism to help manage the discomforts of labor. So like I said, I have seen women do amazing things with hypnobirthing. And so I'm a big fan, but at the same time, I know it's a very personal decision. If I, in my own labor, had tried to listen to the videos, I would have thrown them out the window, or listened to the audio tapes. I probably would have thrown them out the window, because I just don't have a meditation practice. That's not in my personality to get into that kind of a mindset. But I am a big fan. And so, I would definitely consider it. The one thing that I always like to caution people is to think a little bit about what your coping mechanisms will be for labor if you find that the hypnobirthing isn't working. Sometimes hypnobirthing can be a little bit dogmatic, where really the idea is that it's going to work, which is great. But sometimes for women who get into the transitional part of labor, it's not cutting it anymore, and then they fall off a cliff a little bit without any other coping mechanisms to help them manage that stage. So I always like to put it into your bag of tricks for things that can help cope with labor.
Thank you. So again, sounds like the bottom line here is to personalize the care and sort of understand your values and what's going to work for you. And we're here to support that. Thank you, Katie. I'm going to shift gears again to Paige. So during your presentation, Paige, you said something about just being a person in a pandemic is enough, which completely resonated with me. And I think something else you said resonated with me, and also some folks on our event. You talked about the practice of asking for help and how at baseline it's hard for many of us. And then in a pandemic, wow, you just add a lot of layers around being able to reach out to your extended family, around folks that normally would be part of your support structure. Any guidance? How do you do that during a pandemic? How do you stay safe? Any guidance around really building that support structure and asking for help?
So it's a twofold answer, and look, we are in different times here, and I like to say to all of you that are experiencing pregnancy in the postpartum period in a pandemic, I liken it to our great-great-grandfathers and grandmothers who said, you think you had it bad. I used to have to walk 30 miles to school every day in a snowstorm up a hill. Like, this is what women experiencing pregnancy and postpartum are going through right now. So when this is over, I feel like you all deserve the Purple Hearts like nobody else, because this is just making access to support and having those around us that we can ask help for that much more challenging. So as it's very important to ask for help, it's also there's a lot of fear and concern around having who we thought we were going to have around in the postpartum period, our parents, our in-laws, our friends, depending on where we lie on the spectrum of careful and responding to the pandemic. Many of us feel like we don't want anybody coming over, right? We don't want our parents coming as much as we love them. We don't want our in-laws. We don't want our friends. It feels too risky. And so how do we communicate that to these people who have been counting the days on their calendar to meet this little person? And what I want everyone who's on this call to know is You are in charge. You are the CEO of your situation as it pertains to your baby. You are calling the shots, and I want you to feel empowered. I know that it can be really easy to feel guilted into doing something that we think somebody else wants because we want to make them happy. But what I argue is that your comfort is the most important thing in this whole postpartum experience and transition to motherhood. If you don't feel comfortable, it is totally okay to say so. And to say to your loved ones, you know, this is such a challenging time. As a new mother, I have all kinds of anxieties and concerns about what may or may not be transmitted to my baby. At this particular point, I know that it's hard for everybody, but I'd actually feel safest and most comfortable if you met this little person on Zoom just for now. And when we're on the other side of this, I can't wait for you to be a part of this in person. But don't be afraid to say what you want, because you're in charge.
Thank you, Paige. That's a lot of words of wisdom, and I know it's a very difficult time to navigate. I agree with the Purple Heart sentiment as well. All right, so we're coming upon 5:15. I really want to thank everyone that has hung in and listened to our fabulous panelists ask some questions. I'm going to ask for one last quick one. Last question, same question for all three of you, and if you could sort of give us a nugget, really in a quick sort of fashion here, since we only have a couple minutes left. Here's the question. How would you all summarize, what you're bringing to the table today? Some words of wisdom, just a sentence or two. What should people know to really be able to navigate these tough times, take care of themselves, and feel like they're doing enough? A few words of resilience, please.
I'll go first. So I really want to encourage people to trust themselves, to trust your knowledge base, to trust your instincts, to trust that you're going to put together a good team to help you navigate your pregnancy and your birth, and to trust your body, because, we have been giving birth since time immemorial. And it's important that you remember that for the vast, vast, vast majority of people, everything is totally normal and works out totally fine. So trust your instincts and your body.
I can go. I totally agree with that sentiment. I was going to say, from where I stand, I obviously see a majority of very high risk pregnancies. And even in those cases, the vast majority are totally fine and normal. As I said before, mommy guilt is very real. Try to alleviate some of that. Don't worry too much about what you could have done, what you should do, what, you're supposed to do. Just kind of, again, take care of yourself. The happier and healthier you are, the better the pregnancy is going to be.
I'm going to piggyback on Dr. Lam and say the word should be removed from the Webster's dictionary. Should invites judgment of ourselves, and it suggests that we're doing something wrong. And so throw that word away, put it in the garbage can, and just don't ever look at it again, because what you're doing is right, and it's what works for you. And if you find yourself during your pregnancy or postpartum period where you're just not loving every minute of it, and you find that you are feeling anxious or you are feeling hopeless or helpless, that you are not alone, that you did not ask for this to happen. It's something that's happening to you. And that if you are feeling this way, that everybody who seeks treatment and support can feel better and get to the other side of struggling or feeling distressed.
Thank you. All right, so I'm just going to wrap up a sincere thank you to all of our panelists today, Katie, Jennifer, and Paige. A wealth of information that we can all learn from and continue to grow and be kind and give ourselves grace. Thank you all, and a huge thank you to all our attendees. We will be having more events, so please be on the lookout, and we look forward to meeting up with all of you again. Have a great night.
Bye. Thank you.
Bye.